This conference will now be recorded.
Hi, everyone. Thank you for joining us today. My name is Tatiana. So today we're going to be having Dr. Tehrani, Dr. Kashan, and our amazing nurse practitioner, Tara. And so let's begin.
So I'd like to welcome everyone that's joined us on this nice COVID-friendly day to do this. In our past, we always had our flings nicely done in our offices, and this is actually the first fling that we're having virtually. And it's a really nice thing to have all of you join us, albeit not in person, but at the very least, we could talk about some things that are new. If you were joining us during the shutdown, you guys saw that we did a lot of these webinars, and we were able to kind of educate and be able to talk to you guys about the different ways to do things at home. And now that our offices are open, can actually come in to do these, even though initially we'd like to have some consultations virtually. So what I wanted to talk about today is some non or minimally invasive procedures in different ways of improving facial aesthetics and body treatments that are non-surgical. So that's what we're going to talk about. That's what the focus of our flings are about, our non-surgical treatments. Tatiana is going to talk about at the very end some of the specials that we have for the day and in terms of injections and non-surgical treatments. So I'm going to talk about different varying degrees of improvements that could be given using different procedures. So a lot of people have heard about PDO threads, Nuvo threads, basically thread lifts. It's something that's been around now for probably close to 3 to 4 years, within the grand scheme of how aesthetic improvements are done and aesthetic procedures are, actually is quite a bit of a time. So there are FDA approved threads that are out there, and there's not so FDA approved threads that are out there. Nuvo threads is an FDA approved device. It comes in different smooth or threaded devices. It's not necessarily for lifting purposes, at least not all of them are for lifting purposes. Occasionally we use them to fill out lines, support structure, and they give you a bit of a lift. Occasionally the tip of the nose lift, a little bit of a brow lift. So in the grand scheme of things, they're more fillers. Kind of think of them as rigid fillers that we put either in the folds, put it in the lips, put it in the frown lines to improve those areas. So that's Nuvo threads. They come Nuvo Smooth or Nuvo Twist. So think of them as brow, think of them as around the lips, and overall rejuvenation and collagen building. And that's what they do really well. These threads are placed under the skin, so that's how they're able to lift up and build collagen under your skin. And your skin continues to build and simulate collagen about these threads that are nothing very ingenious. They're actually typical suture material that we use in the operating room very regularly, and they're absorbable. So they stick around for about 6 to 8 months, and the collagen building will last maybe a little bit longer than that. So these are some patients that have had these threads done. Again, they're not night and day differences. There are people that needed just a little rejuvenation in the cheek area, a little rejuvenation in the pre-jowl area, and very subtle results, very nice results without fillers. One of the areas that we'd like to put this is around the eyelids, especially in somebody like her who's got the early signs of aging. The problem with that is if you put a lot of filler in that area, you can actually make it aging more and make it look like it actually is puffy more than it is. And some of these fillers are able to do that without causing edema or swelling in that area, and it becomes a really nice option for patients like her. The next step after that is the Silhouette Instalift. So Silhouette Instalift was the first FDA-approved true lifting device, and that's called a bidirectional device. It's a device that actually is made to lift up the cheeks, the jowl line, and the neck. But the reason it's my favorite thread in terms of true lifting is because it actually has a lot of barbs, and in the Instalift, actually the design itself has cones. So it has knots and cones and not exactly barbs the way Nuvo threads was. And its ability to actually catch tissue and lift is phenomenal. That's the best part about it. The worst part about it is, unfortunately, because we have to lift it up, it has a bit of a downtime. So that downtime is something along the lines of about 3 to 5 days, where your face is going to look overly pulled as it settled in, because we exaggerate it to make your face look lifted, and it settles into a little bit of a lower position, and that takes about 3 to 5 days. So it's done similar to an injection would be done for fillers, and it lifts up the face really nicely, and that's my go-to for nasolabial folds, for cheeks, and occasionally for the neck. These are some patients that have had the Instalift done. As you can see, the cheeks are elevated really nicely, super natural still, some elevation in the pre-jowl. These are results that last a good 1.5 years, up to 2 years after having this minimally invasive procedure done. Some of these patients actually end up having a bit of an injection fatigue, where they've had a lot of fillers done, and it's not, at some point in time, it's not about filling anymore, and you have to lift things. And before somebody actually needs a formal facelift, this becomes a really valuable option. I'm a firm believer in our practice that if you're going to have a facelift, it's best to have it done when you're in your early 60s, or maybe even later, depending on how the facial aging is. So you end up doing it maybe once, at most twice in your lifetime, as opposed to if you did it in your 50s and then in 5 to 7 years later, you're starting having repeated facelifts, and that's when it starts looking not so natural. So these are the procedures that will really help get you along during that critical period of time, late 40s, 50s, and get some really natural improvements until the time you actually need a facelift. There's another 57-year-old who needed ideally a facelift, but in her case, she just wanted a bit of a natural improvement. We did the silhouette Instalift. The jowls are better, the cheek line is improved. As you can see, her cheeks are fuller. All we did is lifted it, but she looks fuller, and that's because the Instalift, not only it lifts, it actually builds collagen in that area. And the nice thing about it is it gives you volume and lift. The next solution is a neck solution. So everything we've talked about so far is really good at folds, is really good at the forehead, and in terms of the silhouette lift is really great at the cheeks. It's okay for the neck. It's not great for the neck. So for a very long time, we actually were missing a really good device, a non-surgical thing for the neck. And here comes Elevate. Elevate is a really ingenious procedure which combines neck lift non-surgically with liposuction, skin tightening, and a special thread that is placed under the neck. So it's something that's done under local anesthesia. You have it done, you go home the same day. It does have about a 5-day downtime because you will be swollen and bruised. It's non-surgical, meaning that you are not going to have any scars short of the tiny little holes where we're going to put the liposuction cannula in, or the threads. So this is kind of an idea of where we're going to place these lines. The numbers are for our purposes, but the idea is it has this special smart light that lets us pass a suture that's permanent underneath your skin after we've elevated the neck and tightened the skin, and be able to actually give you a neckline lift. And it's a pretty dramatic neckline lift, as you can see in this patient. It's almost a surgical result with a neckline lift. In the past, we've done liposuction with laser, and if you're young, you actually get some good skin tightening with laser, or body tight, or face tight, or even Renuvion. But a physical suture to hold your jawline back is what the brilliant part of Elevate is. And that combination, again, took ages, years of her age, and has a really great result for the neck, especially for the neck of somebody who doesn't have a lot of collagen building and is a bit older, so they're not going to tighten up as much. So that's another non-invasive treatment for the neck. Next, I want to talk about is a little bit of a a diet thing, something that's not too strange for me personally. We went through a big quarantine, and a lot of people had the quarantine 15 or maybe even more than that after the quarantine stopped, myself included. I actually had the quarantine 20, and we gained a bit of a weight during the shutdown, being around kids, home, and whatever other good excuses everybody had. But in any event, one of the things that we have at our office is the Nuvo diet. Nuvo diet is something that is a medical grade weight loss that we've actually offered patients for pre-operative weight loss. So the idea of this Nuvo diet is, say somebody is going to have an abdominoplasty, a tummy tuck, or liposuction, and they're a bit off of the ideal weight. The idea is that we want to get them as close as we can to their ideal body weight before we operate on them. The best things about this procedure is you could lose, this diet is that you could lose 30 to 40 pounds in 40 days pretty dramatically and pretty consistently. Like any other diet, its biggest problem is the fact that you can then afterwards, if you're not good, you can gain it back and may have to redo the diet. Or in the surgical realm, we want to do the surgery to lock your weight at that lower weight that you are achieving immediately before surgery. So we've used it as a tool for preoperative weight loss and for patients that are struggling with weight in general when it comes to post-COVID weight gain. These are some examples of patients that have lost quite a bit of weight. In her case, 30 pounds in 40 days, and in my case, 40 pounds in over 2 years. So I actually started this journey myself quite a few years ago, and admittedly so, I've gained a bit, I've lost a bit, I've gained a bit, but overall, I've been able to keep the weight off, and I'm probably actually more closer to 45 pounds between those two pictures, and have been able to keep it off using this diet. One of the nicest things about it is the fact that it actually allows you to eat properly and teaches you how to correct things if you had a bad weekend, and are able to kind of reset to a lower weight and not continue on the bad path of losing weight. So other non-surgical things are, of course, CoolSculpting. CoolSculpting is the #1 FDA-approved non-surgical fat reduction and the leading one in the country. It is good for specific area of reduction, whether or not it's your tummy, your waistline. This areas are those areas, the neck, arms, inner thighs. There's about a 20 to 25% reduction with one treatment permanently. A lot of times we do multiple sessions. Like in her case, she had her abdominal area done, her waistline done. It's good for somebody who's got a little pooch, that's exercise intolerant, weight loss intolerant. So again, you need to be pretty close to your weight loss goal before you try this. Even for patients that are a little bit heavier, you don't have a liposuction result. You don't have a perfect tiny tummy or a snatched waistline, but for some patients, having a non-surgical answer for something that they have done within a few hours in the office and then go about their business and have this kind of a result is a really appealing option. So this is for somebody who says, I never want to have surgery, this is something that I want to do, and they run with it. Next, I want to introduce Dr. Kashan, our new associate to our practice. Dr. Kashan I've known for the past 10 years now. He was one of my esteemed residents during training in general surgery training. Then he completed his plastic surgery fellowship at the infamous Cleveland Clinic, where he basically with top artists. Well, I like to think of them as artists in plastic surgery because they're my idols as well. And I'm proud to have him back in our practice now, and he's going to talk to you guys about some good non-surgical facial rejuvenation as well. All right, Dr. Kashan, take it away.
Awesome. Thank you so much for the kind words, and I'm really happy to be here right now. So let's hop right into it. Liquid rhinoplasties. This is hands down one of my favorite types of injectables to do. This is for, hold on, sorry, let me just get this a little bit more organized so you guys can see it. Can you see me okay? Okay. So this is really the way to get the result, or as close to a result of a surgical rhinoplasty, but without any of the downtime. And I really think that's the most important part of the liquid rhinoplasty, that it can be done in 10-15 minutes. It's an outpatient procedure. You really, it really requires very minimal amount of filler, and you can tailor it to whatever the patient is looking for. This is really one of those scenarios that when someone comes to see us for this, they tell us, I really don't like this bump on the back of my nose. I'd like a little bit more tip projection, and you really can get an absolutely amazing result. And you get to go home the same day, and everyone thinks, you know, people won't even realize what you had done, but they'll know that it looks different, and they'll get an idea that you had some type of change to your face. Let me show you a few examples over here. Tati, mine just is not progressing. Sorry about that, guys. There we go. So this is the perfect example of someone that I would say got the perfect result from a liquid rhinoplasty. You can see that there's a little bit of a dorsal hump, and even the tip, if you look at the tip on the before picture, is almost aiming down a little bit. And when you take a look at the after picture, there's that beautiful line that you want to see coming down the dorsum of the nose. It goes on both sides. There's no more hump going on over there, and it's a straight line. And you can see that by doing that, it actually rotated the tip up, which is really aesthetically pleasing. You really want to see that when you do the same thing when you do a surgical rhinoplasty. So it's really phenomenal results you can get with it. Then you can also have this, and this is what I would say I see the most when it comes to liquid rhinoplasties. It's someone that's either had multiple surgeries before on their nose or had traumatic surgery. Someone I had this, not this patient specifically, but someone that's had their nose bitten off by a dog and really didn't want to have any more surgeries done. And this patient specifically had 2 previous rhinoplasties and said, you know what, I don't want to do it anymore. I really want something that I can get done quick and easy and with very minimal risk of causing any more damage to her nose. So if you really take a look at the dorsum of her nose, she has almost a double bump deformity there, where the dorsum of her nose actually collapsed a little bit because her cartilage from the previous surgeries just didn't hold up as much. So what we ended up doing is just literally with 0.1 cc's of Voluma, we ended up giving her that perfectly straight nose that she wanted. And if you really take a look at the after, outside of just it being straight, it makes it look like the tip actually pulled up and rotated up a little bit. Specifically with her, I didn't inject anything into the tip. It actually just does that just by putting it in the dorsum. The other thing is, and we didn't have to do this with her, but a lot of people come in and they've had their septum worked on previously, and they still have a lot of issues with breathing. If you place the filler in the perfect position between the septum and the cartilage in the nose, you can actually improve the breathing. That's something that we do surgically too by actually putting cartilage there. We're just replacing that process with the filler. In this particular case, I use something like Voluma. It's going to last anywhere from a year to a year and a half. You have the option of using something that's not as long lasting, or you could even go something that's a little bit more semi-permanent. My recommendation always is when you start off, always try to start off with the less, and then if you love the results, then go and move on to something more permanent. That way you know and kind of get an idea of what you're going to be getting out of it. The other benefit, which, sorry, let me click here. It's not working again. 1 second. The other benefit before I go to the next slide is there's a lot of people that just aren't ready for a formal rhinoplasty and really, again, want to get an idea of what kind of result they can get out of it. They're not, let's say they're either working, they can't get time off from work, and that's really the ideal person for this. That's someone that wants to go back to work the same day, doesn't have about a week or 2 of, you know, bruising on their eyes and don't want to wear a splint for that time frame, and really you can get them at a position where they look great and they really can just go back to work the same day even. Now, signs of facial aging. Unfortunately, we all go through this, myself included, and you can see the left-sided picture. That's really the young, aesthetically pleasing type of face. You can see that and this is what Dr. Tehrani was talking about, most of her fat is located in her upper part of her face. You can see she has great volume in her cheeks. She's got no wrinkles around her mouth, on her forehead, or around her eyes. And then if you direct your attention to the picture on the right, you can see that she does have some forehead wrinkles. You can see that she has tear trough deformity, so those lines that develop over time underneath your eyes, the lines that develop here, which we call nasolabial folds, and that all has to do with fat kind of descending on the face. And you can see where those lines are right above them. That fat actually used to be where her cheek used to be higher up. And then you can see wrinkles around her mouth, and also the angle of her lips are actually a little bit downturned. So it almost looks like she's frowning a little bit. And then finally, around the jawline, you can see what we call pre-jowls or jowling, which is, again, the descent of the fat kind of coming down on the face. In terms of what we can do for this, you know, dermal fillers are a great option. We have stuff like Juvederm products, Restylane, Radiesse, and really, I think this is where it makes a difference that the person you're going to really understands what the fillers should be used for, why they're used in those specific places, and how to tailor them to yourself. Not one filler is gonna solve every problem there, and I really think that's the important thing. You have to really tailor it to the patient. So I'm gonna go actually back 1 second, and if we're looking at our patient here on the right, and we go from top-down approach, let's say we're talking about her forehead. So everyone always asks, where do you put filler as opposed to where would you put Botox? And the way to really think of that simply is Botox goes where you have muscle that's hyperdynamic. Filler goes where you have fat that has kind of moved or deflated over time. So if we're looking at her forehead wrinkles, that would be an excellent place to place filler. In her particular case, you can actually see that she has a little bit of her brow medially that's coming down. And what we would do is inject Botox here as well, which actually gives you a brow lift here. And we would also do it laterally to give a brow lift there as well. We can't see it as much here because she's not smiling, but she would also probably have smile line or crow's feet, which you can inject Botox around there, which does twofold. It gets rid of those smile lines, and it can also act to elevate the brow laterally too, which is something that everyone always wants. Now, if we're talking about under eye, this is in the last, I would say, 5 to 10 years has become extremely popular, specifically with social media and the way that people take selfies. So a lot of people are actually focusing more on their under eyes and the shadowing, whereas before the answer was put some makeup, put some contour to try and hide it. Now we have a few things in our armamentarium to kind of fix that problem. One of the main things being you can place filler in 2 different levels. I think that if you're going to do under eye fillers, you could put it very superficially under the eye to really kind of taper that eye to cheek junction, make it a little bit smooth, but they also are missing some of the fat in that area. So this is where a nice heavier volume type of filler would be injected onto the bone, and it really pushes it out and really kind of gets rid of that fold. The other thing I would say to do is if you're going to address the under eye filler, you really have to look at it as a full unit. I think that if you're going to do that, it always makes sense to think about doing your cheeks as well. So what the cheeks and putting fillers in the cheeks does, while it also distracts the eye to looking at a more appealing kind of cheek structure, it also actually does a little bit of a facelift. And this is kind of where everyone talks about doing liquid facelifts. This is what they're talking about. This is one of the first stages of doing that liquid facelift, is really getting that cheek filler in, filling in the volume that goes underneath the eyes. And this is the same thing that we would do if we were doing an actual surgical facelift. Instead of fillers, we would end up using your own fat. So it's the same idea. Now, if we're going down to the nasolabial folds here, you can see that they're pretty deep there. Same concept. If you add enough volume into those folds and right around that area, you can actually, again, lift the cheek a little bit. You do blend that so it doesn't look as aged and it doesn't look as sunken in appearance. And it actually gives the appearance of more volume overall in the face. You have to be conservative here. Some people, if you put too much in them, it does make them look puffy. So this is where that finesse comes in terms of how you're going to inject and where you're going to inject. One of the things that I'd say people come a lot about too, if you're looking around her mouth, she does have these wrinkles around her mouth. You can go a lot of different ways of how to treat this, but if we're talking about fillers specifically, I love talking about lip fillers for this. I think if you accentuate the lips, it actually gets rid, for the most part, of those wrinkles around the mouth, and you get the bonus of having fuller lips, and it looks like almost like you're wearing lipstick. You don't have to necessarily put so much in the lips that they're very drastic, but you could put enough where it just enhances them a little bit. And while you're doing that, as I was mentioning before, she has almost a downturning in the corner of her mouth. That's something that if you're going to put filler in the lips, I inject out here and out here as well, which actually gives a little bit of a lip lift at the same time. You also can have the option of kind of doubling up a little bit, doing the filler and also doing Botox injections to the chin area here. And between the two of them, you actually get a pretty significant increase of the corners of the mouth. And now finally, the pre-gel area. This is something that you have to be extremely careful. This is, you don't want to necessarily do this on someone that needs a facelift, but you want someone that's in between, that can use maybe need a facelift in 5 to 10 years, but not really ready for it and still has good skin quality. And while you're doing that, you can inject filler right down on the bone. It gives volume. People don't like that notching appearance where they see the jowling. So what you do is you just blend that in. And this is where I would say, if you're gonna go down that path and you've always wanted to have chin filler, this is the best time to visit that idea, because you're going to be injecting the same thing that you would be injecting into your chin, that you would be injecting into the jawline anyway. So you're building up the jawline, you're building up the chin structure so it matches what you've already built up with the lips and the rest of the face. And that's really how you kind of complete, at least for the most part, a liquid facelift. And what you can't really see on her, but if you were looking at the side view, if you didn't have as well defined the jaw, because that's really what happens. Again, the fat is descending. What you can do is do the same type of filler and really get a very nice face and even neck lift out of it if you put the fillers along the jawline. And it really looks nice if you do it right. You get a really well-defined jawline. So moving forward, all right. So we kind of talked about this already. One second. So I'm going to bring Tatiana over, and she's going to introduce Tara. Thank you, guys.
Hi, everyone. So next we're going to have our nurse practitioner, Tara. She is specialist in cosmetic injections. She has been working with Dr. Tehrani for over 12 years. She is definitely amazing. And today you guys are going to be watching her do some fillers on one of her patients. So I'm going to introduce you guys to Tara now.
See anything? I don't
Yeah.
see anything. Am I on?
Yeah.
Okay. Hi, everybody. I'm Tara, a nurse practitioner with Aristocrat Plastic Surgery. There I am. Hi. I'm a nurse practitioner with Aristocrat Plastic Surgery. I've been working alongside Dr. Tehrani for over 12 years and specializing in cosmetic non-invasive injectables. So today we're going to be showing you my lovely patients. You have to turn it on her.
Yes.
So I'm going to be showing you my lovely patient who has been with the practice for many years. 20 years. And we're going to show you today doing some non-invasive treatments. Jill, can I tell you your age? Yeah. So she's 84, and we're going to show you that surgery may not be an option for you, and if not, then there are some non-invasive treatments that we can do to just help make you look a little more youthful or feel a little more refreshed. So we're going to be doing some Juvederm Voluma, and I'm going to just wipe off Joan's skin so you can see, and we'll look. I'm going to show you the different areas. And as we age, we lose fat, we lose, there's bone loss, there's collagen that slows down. So what the Voluma does is in a class of fillers called hyaluronic acid. And what they do is they help plump up the area where we're injecting. They last about 2 years, and the results are immediate. So I'm going to show you, and we'll do some markings so you can see. So you can see on Joan, when we're younger, the shape of our face is a inverted triangle, and when we start to age, it becomes a square. So you can see where Joan has lost some of her mid-face volume over here, and it's kind of come down, creating some of these lines and folds down to the lower face. So we're gonna add a little of the voluma to the mid-face, to the cheek area, and it's gonna help to lift this area and creating a little more of a youthful look for her and making her look refreshed. So I'm gonna just mark the area. And these markings help me see where I need to treat her.
Hi, Joan. Hi, Tara. Thank you for sharing.
Hi, Dr. Tehrani.
How are you? Joan, it was good to see you. Thank you for sharing for our lovely audience here.
He's saying that thank you for sharing with his audience.
Thank you. We're excited. Joan's excited to be here as always. So we're gonna work a little on her lateral part of her face over here. It's not painful. It feels like a little pinch. How is it, John? Okay?
Fine.
Tara, can you please share with everyone why you use a particular kind of filler in that area as opposed to like the folds somewhere else?
Because we're really trying to keep that inverted triangle. And when you look at the reason why the folds are happening, it's because the latter part, the mid part of her face is losing the volume and starting to kind of come down. So with this inverted triangle, you're helping lift as well as these nasolabial folds, rather than just filling these areas and making her continue to look more square. It makes her look more youthful for the mid face to have some volume. So I chose the voluma because it is soft and malleable, and it's an injection that can last up to 2 years, which is really nice. How's the pain? Is it okay?
Fine.
I'll show you one side versus the other. I'll show you one side versus the other so you can see once you're done. I usually recommend not taking any Advil or aspirin for a few days. Also, homeopathic arnica can help with any bruising or swelling, which Joan had taken prior to the treatment as well. So that was just one syringe, and you can already see how it's lifted and given her that little bit of an arch here, which helped indirectly, lift up this lower part of her face. So I'll go ahead and go on the other side, and we'll add some there as well.
very good.
Really, it's famous.
This is a deeper injection. It's injected down to the periostum, so it lifts from underneath, lifting the surrounding tissue.
That looks great, Tara. So how often do you recommend
Thanks.
Joan have this treatment done?
Say that again?
How often do you recommend
How
Joan have
often
this
do you?
treatment done?
So last and about up to 2 years. But because, you know, Joan's 84, she's going to have more volume loss. And she has, you know, the money. And then
Joan is not 84.
You know, if she does not want to do any surgery, there are a lot of. What's that?
Joan is not
What did you say,
84.
Dr. Ronnie?
Joan is not 84.
No, not 84.
Right.
So there'll be some swelling, which usually lasts about 48 hours, and then that can come down. But you can already see, you know, there's a little swelling here, maybe a little more on one side versus the other, and that's normal. But it already helped to kind of lift this area and restore some of the volume that she had lost. And then it helps with that. Another treatment we're going to do for Joan is some Xeomin. And Xeomin is a neurotoxin. It helps. We have static and dynamic wrinkles. As we're younger, we have dynamic, meaning when we move, when we frown, when we express ourselves, we have wrinkles. But when we're at rest, we don't have wrinkles. But as we start to age, you know, breaking down the collagen in those areas leaves us with some static wrinkles. So you can see on Joan by her eyes, she has some fine lines. And forehead's really not too bad, but can you raise your brow up for us, Joan? And can you squeeze in over here? So what the neurotoxin does is it relaxes the muscle. It releases a chemical that will relax the muscle. And it's just a temporary relaxation of the muscle. It'll help relax these muscles. So this is a downward facing muscle. So when we inject it, it'll help to open this area up. And sometimes when we look at somebody, it's not necessarily, the most important thing isn't necessarily getting rid of every single line. It is, we look at the level of her brow and how we can lift her brow. Those are things that all can make somebody look more useful with neurotoxin injections with Xeomin. So I'm gonna do some of those now. Just gonna. And with the Xeomin, you won't see the results right away. They take a few days to start to kick in, about 3 to 5 days, but can take up to 2 weeks. And then the results last about 3 to 4 months. I'm gonna have you squeeze in here. Okay. Relax. Raise your brow up.
Tara, can you also share when you would use Xeomin versus Dysport or Botox or Jeuveau in different patients, maybe?
What was that, Dr. Tehrani?
Was that Dr. Tehrani?
Can you share when you would use Xeomin versus Botox or Jeuveau or Dysport in different patients?
Sure. So they all the neurotoxins work very similarly. For the most part, after a while, do like to switch to different types of neurotoxins because your body can build an antibody to them if you've been using them for a long time. With Xeomin, they take out some of the unnecessary proteins, so that minimizes the chance of antibodies forming. So for somebody that's been on Botox for a long time, sometimes they'll switch it up and do Xeomin. Dysport as well. Dysport does kick in a little quicker, so within 48 hours that kicks in, and so does Jeuveau. But they are all really fairly similar. Sometimes one may last a little longer for one patient versus another, but for the most part, they're very similar. Raise your brow up. You see, I'm asking Joan to kind of raise up because with her movement of her muscle, I want to see really where she's pulling, and that's going to help achieve the best improvement. And then now smile for me. Okay, and then can you wink this side? Okay.
Yeah.
Wink. Yeah, you can see like where she's pulling around here, and then all throughout this muscle around her eye. Then we ask you to move your muscles around to make the neurotoxin work in quicker. That'll help it work into the muscle a little quicker. And then aftercare for more so for the fillers, are using some ice for about 48 hours. And that'll minimize the swelling as well. So you can see with the Xeomin, you don't see the results right away, but over time what will happen is this muscle will lift up, the brows will create a little bit of an elevation in the lateral part of the brow, and then this will smooth out some of these fine lines. With the and that will see over the next few days. The voluma is pretty instant as well as some swelling, but yeah, I down in about 2 days. So I don't know if they can hear anybody.
They can type them in.
Oh, they can. Let's see if there's any. No. If anybody has any other questions that they think of, they can always call me and email us, and we'd be happy to answer any questions you have regarding any treatments.
Thank you,
Okay.
Tara. Great
All right,
job.
bye,
Thank you,
everybody.
Joan, for sharing.
Soon.
And we're gonna go to our Q&A bit, and we'll answer your questions. In the meantime, ice and enjoy.
Okay, thank you. Thank you.
All right.
Hi guys, so now I would like to talk about our giving things together. So for now we have 30% off of non-surgical treatments, including Botox, fillers,
Tatiana,
lasers.
share your screen.
Oh, I'm sorry. Okay, can you guys see it now?
Yes.
Okay, so as I was saying, we do have 30% off for this week of non-surgical treatments, including Botox, fillers, lasers, peels, and more. And if you guys have any questions, at the end you will see our phone number, email, so you guys could reach out to us. So now Dr. Tehrani and Dr. Kashan would like to answer some of your questions.
Yep.
So one of the questions says that, does CoolSculpting kill fat cells? So CoolSculpting, the way it works is by killing fat cells, and you want it to. So CoolSculpting permanently removes fat cells, and that's about the 20% reduction that you get with CoolSculpting, 20 to 25% reduction. So that permanently reduces fat cells. It does it by a process called apoptosis, which basically tricks the fat cells into killing themselves. So they actually freeze away the inside part of the cells and they go away. And that result is permanent. Now, next question is, are our fillers, it says 305 off, but I think they mean 30% off. So all surgical or non-surgical treatments, including fillers, metastatic treatments, all of our lasers are 30% off now. We obviously cannot do everybody this week, even though in the years past we actually used to do that during our fling bonanza, but now we actually extend it, so you can, as long as the purchase happens within the first week, which is this week coming up, you can actually bank it and have actually treatment done within the next 3 months. Next question is how to treat eyelid sagging. I'm going to let Dr. Kashan handle that question.
Awesome. So yeah, I mean, it's kind of I guess a little bit of vague, but there's a couple options. It depends what you mean by sagging. If you're referring to the lines underneath the eye, that's something that we could definitely put filler under, like I said, and give some volume over there to kind of blend it in a little bit. So I will say it's not an option for everyone. So it's not an all-comers type thing. If some people that even if we put fillers in there, that kind of bulging appearance to it, you may end up needing surgery anyway to correct that. But fillers is definitely an option there. I'm assuming that's what we're talking about with eyelid sagging. Sometimes you can actually get the eyelid itself that droops a little bit. That's something that would need to be corrected surgically. You can't do that with fillers or Botox or anything like that. So that's a great question.
So those are great options. A lot of times eyelids is the first sign of aging, the same way that Dr. Kashan was talking about. Like, part of it could just be genetic, and you may not even, you may be young, and those are the young ones that we can actually inject to make it look like, kind of make that shadowing go away. There's some non-surgical ways we could treat lower eyelids. Ultherapy is one where we can actually treat the skin underneath non-surgically. E-matrix is another one that we can treat the lower eyelids non-surgically, and something that we use a lot of non-surgically, especially during our flings, is Thermi Smooth, which uses a radio frequency to tighten the lower eyelids. Again, it's for somebody who doesn't want a surgical result. It actually improves that area without completely, having surgery. And in some patients, surgery is the real option. And surgery is doesn't necessarily mean you have some big surgery. And occasionally, especially upper eyelid surgery, we can even do under local anesthesia. So that's kind of a long answer to that question. Next question is whether or not we offer human growth hormone. We do not. Testosterone and human growth hormone are something that are somewhat controversial, and it's not something that we do in our practice. And that's something that we do not do. I'm sorry. The next question is about CoolSculpting again, whether or not it causes nerve damage to the neck. So CoolSculpting does not. CoolSculpting basically removes fat cells, so it actually doesn't do anything to your nerve. There is another procedure called, or non-surgical injection called Kybella, which has gotten a lot of press recently because it's the first as an injectable to melt fat cells, and it's the FDA approved the fat melter of the neck, and that has caused some not permanent but temporary nerve, I hate to call it damage because it's temporary, but just some weakness of the nerve of the neck, which over time improves, but not CoolSculpting. I think I answered most questions or all questions already.
I think there was just one about, I don't know if you answered about how long does the liquid rhino last for?
Oh yeah, please go ahead.
Sure. So to answer that question, really, it ultimately comes down to which type of filler works best for you. On average, I would say you probably get about a year to a year and a half out of it. If it's something that you really aren't sure about and you would rather a lesser duration of time, we could actually tailor the type of filler so it doesn't last as long, and it would last probably closer to 6 months. But in general, everyone tends to want something that lasts a little bit longer. So we go based on what you're really looking for, and to kind of parlay that into how much does it cost. It costs the price of whatever filler we end up going with. There's no actual price for the liquid rhinoplasty other than just whatever we decide to use.
All right, great. So Tatiana, if you want to do your raffle thing, yeah, I think we can go there now.
Oh, sorry. It looks like we have some more questions that just came.
Chat.
Oh yeah, go ahead.
Yeah, right here. Is CoolSculpting.
So for Dr. T, is CoolSculpting more effective than laser lipo?
No. So CoolSculpting is a non-surgical treatment. Nothing non-surgical is as good as surgery. So CoolSculpting does not replace surgical results. It's for somebody who has had, who doesn't want to have surgery. So liposuction, even though it's minimal surgery, it's still surgery. You're gonna have bruising, you're gonna have swelling. Whereas with CoolSculpting, you don't have any of that. You may have a little bit of bruising, but you're kind of back to normalcy. And that's one of the nice things about CoolSculpting, is for somebody who truly has some stubborn areas that are otherwise fit, or stubborn areas and don't want to have surgery. So the results are, I can't say they're comparable. So sculpting and liposuction is a different animal.
And then someone asked
another question about how. Go ahead.
Oh, sorry, about CoolSculpting. They already had one round of CoolSculpting, and they want to know, does it make sense to continue with CoolSculpting, or would you consider lipo in the future? And I guess that they're saying maybe they don't see as much of a result initially.
Yeah, so if you're not seeing a lot of a result with CoolSculpting, you should consider surgery, and something that we need to examine you and take a look at. There's a very, very small set of patients that have CoolSculpting that have this thing called paradoxical hypertrophy, or the actual fat cells go into this ori of kind of actually overdeveloping. It happens less than 1% of the time, very rare, but it can actually be something that needs to be addressed. So it's best to be able to take a look at each individual patient and be able to cancel them after a consultation.
Great. Next question, is Tara still with us? I can't see, but people, I guess she stepped out. But so the next question is, how long do lip injections last? And I could take that. I mean, again, this really depends on the type of filler you use, but for the most part, I'm going to say it lasts, if you get to the point of 6 months, that's excellent. I'll say most people tend to come in before that 6-month mark, because now that you've already built up your lips with a little bit of that lip filler, the best time to do it is while you still have a little bit in there, so then you can maintain that fullness. And it's actually easier, or at least I find it easier, to re-inject someone that has a little bit of filler in to really get that volume, as opposed to having to rebuild it from scratch. So I'd say on average, we see people that do get lip fillers every 4 to 6 months. And it really, some people come in sooner, but that's just because they love the way it look and they want to even add more volume. So you do always have the option. A lot of the time, everyone's a little afraid their first time. They don't want to put too much in. So we always start off small. I always recommend start off with 1 syringe. You know, you have the option of coming back in a week or two. And if and when you do love it, we could always add more in. So you don't have to commit to a higher volume right away, especially if it's your first time.
That's actually a really good point, and it's something that we do quite often. And probably after Botox, lip injections is the number 2 thing we do. And the idea is being subtle, and the idea is adding volume and then adding a bit less after time. That's part of the reason why we actually carry half syringes. So we carry Volbella, which is a half syringe for not really a touch-up, but really a top-off. So you're coming for a little sprucing, nobody knows you did anything, and you get a little bit of a great result before it comes off all the way, and then you can have that done fewer times in the upcoming months. So it's about doing subtle, smaller improvements.
And I think that's all we have question-wise, right? We're out? Yeah, that's the last of it.
Great.
So now I would like to talk about our raffles. So we're gonna have 2 winners for discounted breast augmentation with Dr. Tehrani, up to $2,700 off. Then we also have 4 cycles of CoolSculpting. And we're also gonna have 2 winners of 1 Botox treatment. So each winner will get 1 Botox treatment. We also have 1 syringe of Juvederm Ultra Plus XC and a peel package. So 2 winners for peel package, 1 in NYC and the other one in Great Neck. We also have, lastly, we have 1 complimentary surgical consultation with Dr. Tehrani. So you guys could take a look at the slides. And right here, I'm going to show you guys our contact information. Please let us know which raffle you would like to participate on. And we will write it down and announce the winner for next week. You guys could also send us a message in our chat just to let us know which raffle you guys would like to participate. So I'm going to go back to the raffle so you guys could take a look and decide which one you would like to participate. So please send us a message in the chat, or you can email us with your full name, contact number, and the raffle that you guys would like to participate. So I'll repeat the raffles again. 2 winners for discounted breast augmentation with Dr. Tehrani, up to $2,700 off. 4 cycles of CoolSculpting, 2 winners of 1 Botox treatment, 1 syringe of Juvederm Ultra Plus XC, 1 peel package in NYC, 1 peel package in Great Neck, and 1 complimentary surgical consultation with Dr. Tehrani. So please let us know. I'm going to show you guys our email in case you guys want to email us instead of sending it in the chat. And this is our best contact email, info@aristocratps.com. And let's stay connected. Thank you guys for joining us today. Dr. T, I don't know if you want to say bye.
Ask for their contact information. They're putting all their.
Where is it? Chat. Let me see. Oh, I see the chat. Botox ways. Okay, guys, I see that you're writing which one you would like to participate on, but can you please write your full name, phone number, and the raffle? That way we have the whole information so we can contact you guys. How much for Botox? I see that you sent us your phone number, so I can certainly have one of our patient coordinators contact you and give you all the information in regards to this. Thank you, guys. Okay, I see that you guys are sending the phone number now, so that's great. For those of you who don't want to send it in the chat, remember this is the email that you can email us at and just let us know that you watched the webinar and which raffle you would like to participate. Alicia Greatnight.
Some people ask how much Botox, say it doesn't matter how much.
All right, guys, so that was it for today. Thank you guys for joining us. Thank you for watching. Thank you for staying until the very end. We will definitely be announcing the winner next week, so we will keep you guys posted. Thank you for watching.